sending more medical supplies to hospitals, deploying additional emergency medical teams, and scaling up medical evacuations. Today, WHO teams are at the Kerem Shalom crossing collecting medical supplies. And yesterday, we supported the evacuation of 41 patients and 145 companions to several countries. I thank the more than 20 countries who have received medical evacuees from Gaza. However, there are still 15,000 patients who need treatment outside Gaza, including 4,000 children. More than 700 have died while waiting for evacuation. We continue to call for the restoration of referrals to the West Bank, including East Jerusalem, and we call for more countries to receive patients from Gaza for specialized care, and we call for the Rafah crossing and all crossings to be opened to allow more patients to be treated in Egypt and to enable the scale-up of aid. Although the flow of aid has increased, it's still only a fraction of what's needed. The Rafah crossing was supposed to be opened last week. A significant amount of aid has built up at Al Arish in Egypt that's ready to enter Gaza as soon as the crossing is opened. While we're focusing on responding to today's health needs on the ground, we're also working with partners to plan for the long-term recovery and reconstruction of Gaza's health system. Over the next days and weeks, WHO will focus on 4 areas. First, maintaining life-saving and life-sustaining essential health services. Second, strengthening public health intelligence, early warning, and prevention and control of communicable diseases. Third, coordinating health partners. And fourth, supporting the recovery, rehabilitation, and reconstruction of the health system. Our 60-day ceasefire plan asks for $45 million, but the total cost for rebuilding Gaza's health system will be at least $7 billion. WHO was in Gaza before the war started. We have been there throughout, and we will stay there to help the people of Gaza build a healthier, safer, and fairer future. There is more good news in the Democratic Republic of the Congo, where the Ebola outbreak seems to be on track to come to an end. Last Sunday, the last patient with Ebola was discharged in Bulape after making a full recovery. The 42-day countdown started officially on Monday, meaning that if no further cases are confirmed, the outbreak will be declared over in early December. In total, 64 cases have been reported, with 45 deaths and 19 recoveries. This illustrates again what a dangerous disease Ebola is, but it also shows that with strong government leadership and the right tools, partnerships, and expertise, Ebola can be controlled swiftly. The outbreak is not over yet. Measures on the ground need to be maintained so that we're ready to respond to any new cases. More than 250 community health workers are following up contacts every day. Some of them walk for hours through forests and swamps to reach the most isolated villages. Since the start of the outbreak, almost 1,000 alerts of potential Ebola cases have been reported, many coming from communities themselves, showing the importance of working hand in hand with affected populations. The response in Bulape also relies on strong community mobilization, with community leaders briefing their people, including at markets and churches, to raise awareness about vaccination and isolation and reinforce trust in the response. WHO has deployed over 100 experts, providing 150 tons of medical supplies, ambulances, motorbikes, and digital tablets for rapid data collection and sharing. We're also supporting the government to ensure that people who have recovered have continuing care through a survivor care program. Responding to emergencies is just one part of WHO's work. Supporting countries to prepare for them is another. Today, WHO is publishing our new National Health Emergency Alert and Response Framework, which outlines the key steps for an effective and coordinated emergency response locally and nationally. That includes dedicated systems with clear roles, a trained workforce, flexible procedures to deal with rapidly changing information, and more. The framework has been developed based on lessons learned from real-world experiences, including the COVID-19 pandemic. Finally, tomorrow is World Polio Day. When we launched the Global Polio Eradication Initiative in 1988, more than 350,000 children were paralyzed by polio every year. Today, that number has dropped by more than 99%. Just 36 cases of wild poliovirus reported so far this year. A large part of this success is due to the leadership of Rotary International, who have been pathfinders for polio elimination. This week, I had the opportunity to welcome partners from Rotary here at WHO and thank them for their partnership in bringing us so far. But we're not done, and as long as polio exists anywhere, it's a threat everywhere. Decades ago, the world overcame geopolitical and geographic barriers to end smallpox. Let's do the same for polio. Let's finish the job. Tariq, back to you.
Thank you very much, Dr. Tedros, for these opening remarks. To speak more about the situation in Gaza, we have online Dr. Rick Pieperkorn, who is our representative for occupied Palestinian territory. We also have online Dr. Mori Keita, who is incident manager for the Ebola outbreak in the Democratic Republic of Congo. Online is also Dr. Kate O'Brien, that you know very well, our director for immunization, vaccines, biological. And we have also Mr. Rob Holden, who is a unit head for emergency response coordination. Remind journalists, please click the icon, raise hand, so we can call on you. And we will start right now with Nina Larson from AFP. Nina?
Yes. Hi, thank you very much for the briefing and for giving me the floor. I was wondering, yesterday the International Court of Justice ruled that Israel could not use starvation as a weapon of war in Gaza and also needed to help humanitarian agencies bring in aid. I was wondering, you mentioned a bit about what you're trying to do in Gaza, but have you seen a dramatic shift in the amount of aid that you're able to bring in? And also, have you seen any dent in the hunger levels since the start of the ceasefire? Thank you.
Thank you, Nina. Let's go to Dr. Pieperkorn. Dr. Pieperkorn?
Thank you very much, Tariq. So let me first say something general on access. So with the ceasefire in place, so access has improved to some extent. But you heard, and that is allowing WHO to reach hospitals and supply partners more easy and more frequently to fill urgent gaps. But this is just a tip of the iceberg, and you must have heard this from other UN partners as well. So currently you have Kerem Shalom and Kisufim crossings which are open and where supplies are flowing into Gaza, but too few supplies. Rafah remains closed for people and supplies. So it's vital that that is urgently reopened. On top of that, we see still a closure of Zikum and Erez crossings, which provide direct access to the north, make it much more challenging to reach the people there with vital support at scale needed. And that is even more important, I would say, for when you talk about food and wash and shelter. So all these crossings should be opened, etc., for food, wash, medical supplies, etc. For WHO, So we have scaled up the efforts to bring supplies in, and since the ceasefire brought in 139 pallets of vital supplies, not just, by the way, for WHO, also assisting health partners. WHO brings it in for other partners as well, including insulin, lab supplies, essential medicines, etc. But just to give you an overview, what we still have waiting. So only WHO, we still have 2,100 pallets of medical supplies ready to move to Gaza via the West Bank, Jerusalem, Ashdod, Al-Arish, Cairo, Amman, and Dubai. In addition, we still have for 4.5 million in supplies stored at the Dubai hub, ready to prepare it for dispatch, depending upon the priorities of the response. So WHO global supply chain has the agility to respond to the constant evolving needs of this ongoing emergency. And as Dr. Tedros referred to today, actually, we have a team again in Kerem Shalom picking up more supplies to get it. So on Monday, for the overall UN, at least 145 UN coordinated trucks carrying nearly 1,500 metric tons of aid were collected from Kerem Shalom or Karam Abu Salam and Kusipum crossings. But in terms of aid entering into Gaza, on Monday, 263 trucks from the UN and its partners were offloaded at Kerem Shalom. It's increased, it's an increase, but much more is needed. Over to you.
Thank you very much, Dr. Pieperkorn. Dr. Zakaria, would you like to add something?
Thank you very much. I wanted to just highlight as well, because the question did address as well issues of malnutrition-related death. And I think it is important for us to be able to know how many people have lost their lives due to extreme lack of food. But it's also important to remember that all of these deaths were preventable. And there are hundreds of thousands, over 600,000 people in Gaza who are facing catastrophic level of food insecurity. And so it is our collective duty to also make sure they do not lose their lives, because we have not been able to scale up the aid at the level that we require. And it's also the same thing when we talk about severe food insecurity, especially the catastrophic level of food insecurity in so many countries. And that includes, of course, the population, the people of Gaza, but also those of Sudan, Haiti, South Sudan, Mali, and many other countries too, for which, the number of those who are at that very critical level of food safety is also at risk of actually going into irreversible health consequences. Thank you.
Thank you very much, Dr. Zacharias. Next question, Kuna News Agency. We have Iman Herji. Iman.
Thank you so much. Just a question. You mentioned actually the violation of the ceasefire in Gaza. Could you give an update on how many injuries did you register after the ceasefire? Thank you.
Thank you very much, Dr. Pieperkorn. If you have not heard the question, it was, do we know the number of casualties reported since the ceasefire took place?
I quickly have to go back. I think it was over 80, but I'm not over 80. I have to get the correct number though, but I think what I saw in my mind, it was over 80. Over 80, we will get back later. Maybe can I address the one question on malnutrition, the former question on malnutrition, just coming out of Gaza 2 weeks ago when the ceasefire were announced. So the food situation has slightly improved. But it will take a lot more to actually reverse the situation. It's good to note that a new IPC analysis is underway, and that will shed more light. Overall number, what we have seen, that 411 people have died in 2025 from the effects of malnutrition. Of them, 109 were children, including 84 under 5s. Over to you.
Thank you very much. And I think Mr. Nabil has figures that have been asked for.
Yeah, thank you, Tariq. So, just to complement strictly on the figures, and this is also figures coming from the MOH. Since the ceasefire is in place, 89 were killed and around 317 total injuries, according to the MOH. Thank you.
Thank you very much, Mr. Tabal. Now we go to the next question. We have Christian Ulrich from German news agency DPA. Christian?
Thank you, Tariq, for the perfect pronunciation of my last name also. I would like to get some more details on the medical evacuations that Dr. Tedros tweeted about last night, the 41 children. Maybe you could give us more details whether these were injuries or sick children, and especially where they were taken and who's going to care for them now. Thank you.
Thank you very much, Christian. I guess we go back to Dr. Pieperkorn.
Thank you very much. So I think the medevac from yesterday, we talk about 41 critical patients. They were all children, including 145 companions, over 180. It's the first medevac since the ceasefire. I can't give you yet full details on the countries because due to operational concerns and when children will have arrived there, we will make sure that we will share that. I want to stress a thing about medevac. It's a flagship program of WHO. We aim, and we are very much ready to scale up to a minimum of 50 patients per day plus companions in line with the previous ceasefire. So still some figures. Since October 23, WHO supported a medical evacuation of 7,782 patients to over 20 countries. The estimate is, from the Ministry of Health, that still over 15,000 people still need medical evacuation. So our key asks are very simple. First of all medical corridors need to be opened. The most important one is to reopen the West Bank and East Jerusalem referral route. We've had discussions with hospitals, directors, East Jerusalem and the West Bank, and they are very much ready to receive those patients and the companions. That's the first and most important key ask. That would be a little game changer. Then, of course, a Rafah crossing to be opened for patients to get transferred into Egypt and possibly from Egypt to other countries. And a continuation of the medevac through Kerem Shalom to Ramon Airport, to other countries, and to Jordan. More, as the second ask, more countries must step forward to receive patients. We are currently planning medevacs for next week. We would like to plan medevacs for every other day, or actually we would like to plan for medevac every day. Over to you.
Thank you, Dr. Pieperkorn. Let's go to News Agency, Spanish News Agency, Antonio Breto.
Very much, Tariq. This week in the European Union, the clocks are being changed to winter time. This is a practice that in recent years has increasingly been questioned. And this week, Spain, the government of Spain has called for it to be abandoned next year. So we have had the economic, energetic perspective, but I also would like to have the health perspective and to know what is the WHO position on this change of hour, whether it's beneficial or harmful from this health perspective. Thank you.
Thank you, Antonio. I don't think that we have anyone here who can answer, but we will definitely go to our colleagues and check if we have something on that, and I'll come back to you by email. Thanks for coming and asking that. I understand that Christian has a follow-up question. Can we go back to Christian?
Thank you. Yes, my follow-up is to Rick. Is the problem with more medical evacuations that you do not have recipient countries or hospitals who are willing to take them, or is the problem that Israeli authorities are not facilitating the move of these patients? Thank you.
Well, I think there's two major challenges here. One, we need all the medical corridors to be open. So one is definitely linked to the Israeli authorities, because I think we have advocated from the start of the crisis to reopen the traditional referral pathway to the East Jerusalem hospitals and the West Bank. Before the crisis, I think good to note that between 50 to 100 Gazan patients per day were referred to the East Jerusalem hospitals and to the East Jerusalem hospitals and to the West Bank hospitals. The hospitals are ready, the Palestinian Authority is ready to receive these patients, and that would be definitely a little game changer. We've also noted that a lot of countries are supporting that, and that a lot of other countries will support it, and also WHO, we are ready to then, for example, support the East Jerusalem hospitals and the West Bank hospitals when needed. So that's one. Then the other crossing which needs to be open is the Rafah crossing, which was already highlighted, etc. It would be another medical corridor for patients to be transferred to Egypt, and from Egypt possibly to other countries. And the other one should be constantly open is the Kerem Shalom to Ramallah Airport and Jordan. So yeah, from the Israeli authorities, we want more dates for these medevac crossings, but we definitely need more countries to receive patients, because we always talk. I mean, like that. People ask me, "Oh, can more patients go to Egypt?" You shouldn't ask me. That's a question for the Egyptian authorities. But we are incredibly grateful to specifically the countries in the region, like Egypt. They have received close to 4,000 Gazan patients already. UAE, more than 1,000. Qatar, I believe UAE 1,200. Qatar 1,000. Jordan, Turkey, etc. So we really plea with other countries as well to open up. I also want to clarify that we are currently with the approvals. I think, yeah, we are, I would say, currently working well with the Israeli authorities, but the routes are not all routes are open, and they prevent an increase in the medevac. And of course, more countries need to open up for these patients. And I also want to make a point that we, understandably, we always get a focus from countries. They want a specific group of patients and children, and we all agree with that. From the 15,000 patients still to go, 3,800 are estimated children. And they are, of course, a priority group. But I also want to say there's many elderly, many adults, many older children, adolescents, etc., which also need to be medevaced. And countries should be open for all groups, including their companions. Over to you.
Thank you very much, Dr. Pieperkorn. We have a question from Guillaume Berne from French International Radio, who says that his microphone is not working. But the question is about Ebola outbreak in DRC, and he's asking how could you explain the success of the response in ending Ebola outbreak in DRC. So maybe we can ask Dr. Maury Keita to join us and give us update on the response. Dr. Tedros.
So before we go to the Ebola one, sorry for raising my hand later. The medical evacuation, as Rick said, it's both ways. First is from the recipient country side. So far, 20 countries have received. Not more than 4 or 5 countries have received significant numbers. The rest, very few. So that's why Rick was asking, and I said it in my statement, if countries could really open up and welcome those patients who need critical care. So there is that side from recipient countries. Of course, so far, Egypt, Jordan, UAE, and Turkey, I think, have taken the most out of the 20 countries. But we encourage other countries all over the world to welcome patients for critical care. And the second part is from Israel's side, the number of medical evacuations are limited, once a week. For instance, we have done one last week after 2 weeks because of the Israel holidays. So one evacuation per week is not enough, and we are evacuating through just 1 or 2 major corridors, and 1 or 2 corridors are not enough. But the most impactful could have been if Israel could allow patients to go to East Jerusalem and the West Bank. That would have been actually a better option. So that's then in the hands of Israel to allow, because they could get service within close proximity. So if this could be addressed, then the 15,000 patients waiting for evacuation, a significant number of them could have received some support immediately. Because the delay in medical evacuation, especially for some patients, means they could die while waiting for evacuation. And that's what happened, actually. More than 700 people have died waiting for medical evacuation. So those in the list are critical patients, and they need, time is the essence. So that's what we are saying. And then there was the other question which I wanted to add, but I also missed that, so I would like to add to that. Is there a shift in amount of aid? It's very difficult to say a shift. There is no shift, but there is increase in amount after the ceasefire, but what is entering Gaza is significantly below the required target, significantly below the required target. And that also can explain the second, can be an answer to the second question. Is there a dent in hunger level? So if the aid that's entering Gaza is significantly low, it cannot dent the hunger level. And the situation still remains catastrophic because what's entering is not enough. So the two actually questions are one and the same. So the answer is no shift in amount of aid because what's entering is significantly lower than what's expected, the target, even the UN target per day. And there is no dent in hunger because there is not enough food. And the other part of hunger is hunger takes also more time to have a dent. And that's why I think we said some days ago, especially in terms of players on the ground, Israel should allow more NGOs to operate, especially some of the international NGOs who have been operating in Gaza and who have been delisted should be allowed to work because need a surge to deliver food. But of course, the two should go side by side. One is the amount of food or aid that enters should be significant enough. And second, there should be also a good distribution system on the ground to reach all those who are affected. And then on the daily entry, the trucks, the number that's entering now is between 200 to 300 per day compared to the 600 target. And even from the 200 to 300 that's entering Gaza, a good number of the trucks are commercial. And many people don't afford to buy. So that also reduces the beneficiary size. So that's why, the dent in hunger, you can't even talk about it at this time. Thank you.
Thank you so much, Dr. Tedros, for adding these remarks. Let's try now to go to Dr. Mori Keita in DRC to tell a few words about Ebola as a response to RFE question. Dr. Keita?
Thank you, Tariq. So I think the rapid control of this outbreak could be maybe explained by a conjunction of a number of factors like rapid case isolation and treatment. So WHO and MSF, for example, were able to establish one of the innovative, treatment centers, here in Bulape, and in which we have 2 intensive care units. So, which is, of course, a good thing for clinical care. So we also have effective vaccination strategies. So it's important to recall that we had 2,000 doses in the country before the declaration of this outbreak, so which allow us to be prompt in our vaccination. And we also use 2 strategies in this vaccination. The first one was the ring vaccination, so vaccinating case around cases, so contact and contact of contact. But also we also used a targeted geographic vaccination. Now we have been able to vaccinate roughly 37,000 people in Bulape and surrounding areas. So another thing is also strong surveillance and outbreak management. So I think we were able to quickly detect the cases from the community, to isolate them, but also to follow the contact until the end of the 21 days. So another important aspect is also the community engagement. I think it's very important also to recall that this is one of the particularities in this response in Bulape. So we had a very strong community engagement. So, all the community leaders are supporting us, the community members, because here we have chief in the chief, so traditional chief in place, so that are well respected by the community. And if they are supporting, or maybe if they are guiding the community, they use to follow, so which allow us also to implement, all our intervention here. So one of the important aspects is also the logistics. So the timely logistics and the resource mobilization. And we were able, thanks to MONUSCO, to establish quickly the air bridge, because Bulape is a hard to reach area, so there is no roads to reach Bulape, but we are able to have this air bridge, which allow us to have to transfer staff and supplies and so on. So this is a number of aspects which personally I think have contributed to the success of this outbreak response. Of